You can see it, registration assessment. I want to do this because I haven't actually seen this. So these are actual questions. So a 3-year-old boy suffers from asthma, intermittent wheezing despite Clenil. What's Clenil?
Is it
Yeah,
beclomethasone?
so what's the side effect of that?
Steroid inhalers.
What colour does your mouth go?
White.
Yeah, why?
Because of the, you have to
Yeah,
thrush.
So wash your mouth out, wash your teeth. They never do it. His parents are administering salbutamol aerosol inhaler to him at least once a day. That, as a pharmacist, you should think salbutamol should only be used when really required. So if they're using it consistently every day, it's possible that they're on the wrong step. So they should maybe moved up to the next step. Oral steroids, maybe using a long-acting one. Child weighs, but that's probably not relevant. The child weighs 15 kgs. Otherwise, well, what is the? Oh, okay, so it is relevant to a certain extent.
So what you have to do is maybe go to the BNF and see what's the next step.
Yeah, what the next stage is, and what do you know is the next step? So he's on Clenil, and he's on Clenil, and and he's got a spacer, and salbutamol. So I reckon.
Is it B?
Yeah, it's not going to be that.
Because it's the same, isn't it?
Yeah.
But higher dose.
But it's probably that. You're right. Because this is probably adult. This is probably too extreme. So B. Yeah, we got it right. Good job.
Oh, good.
You are asked by a local GP. So you didn't even need the BNF there. Well, I know that this is a pediatric dose.
Yeah, 4 milligram, because you see it pediatric montelukast, don't you, on the shelf? So.
Yeah. This is impossible because it doesn't come as 300.
Oh, okay.
It comes as 200, 250, I think it's the top.
Yeah, 250. You're right.
It could be this, it could be that, but it's definitely not that. So yeah. You're asked by a local GP to recommend treatment for Mrs. Z, who has oropharyngeal candidiasis. What's that, Merlin? Oro is going to be the mouth. Pharyngeal is kind of a bit lower down, so I think it's throat thrush. That has not responded to nystatin suspension. Given that she is otherwise well, not allergic to any medicines, breastfeeding a 5-month-old baby, which one of the following would it be most appropriate for you to recommend to the GP? So she's unresponsive to nystatin.
Yeah.
Otherwise well, not allergic, and is breastfeeding her 5.
I think you're looking for something that won't go through the breast to the baby.
Yeah.
So.
So you're giving it to the lady. Breastfeeding.
How would you figure this out?
You would look up oropharyngeal candidiasis in the BNF.
Okay.
And there's probably a prescribing protocol. BNF. It probably doesn't come under oropharyngeal though, does it? Because that's quite specific. Oh, it does. Oropharyngeal fungal infections.
Yeah, oropharyngeal infection 547. Let me see. Yeah, there is nystatin and fluconazole.
So nystatin, first line, or miconazole. Is miconazole an option? No.
No.
Okay. So fluconazole is effective for unresponsive infections, or if a topical antifungal cannot be used, or if the patient has dry mouth. So what's your next step after that?
Fluconazole.
Would you just take that as the answer?
I can't find fluconazole on here. That's another thing. Fluconazole given by mouth is reliably absorbed. Traconazole can be used for fluconazole-resistant infections. Yeah, I would take C.
Yeah, but what about this?
Breastfeeding. So you'll have to
Look it
look
up. Yeah. So it's probably right. Yeah, it is right.
Okay.
But I would just, because there may be something in the BNF that says you can't give it to breastfeeding. Let's say you can't give it to breastfeeding. What would be your next? See, there's no other option, is there?
No.
Because nystatin doesn't work. Miconazole isn't an option, so you have to go for fluconazole. What's the best thing for a child with oral candidiasis who's breastfeeding?
I don't know.
This.
Dactarin. So dactarin is actually miconazole, isn't it? Miconazole gel.
It is, but it comes as is this. You'll see this in the pharmacy. Oh, can I see it? This orange one.
Oh yeah, the oral gel.
So what happens is they get oral thrush. The mother supposed to. It tastes like oranges. Supposed to put it in the baby's mouth, but also put it on the. Because the problem is cross infection. So if they're taking breast milk, the baby can transfer it to the nipple. So with breastfeeding women, you can say put this on your nipple and put it in the baby's mouth.
To stop the cross infection.
Yeah. GFR. What's a GFR?
It's the creatinine clearance, isn't it?
Glomerular filtrate rate.
Filtration.
So something to do with the kidneys. Which of the following test results would not be expected in a healthy adult? You know, you said at the beginning, are you expected to know this? I don't. But it's in the BNF somewhere. What do you think?
Is it really?
Yeah.
Oh yeah, it is. There's a table, isn't there?
Yeah. But immediately, this one sticks out, doesn't it?
Because it's quite a big.
Yeah. What's the answer?
32.
C. So it's A. A is the direction summary.
So all of them would not be expected in a healthy adult.
Would not be expected. Okay. So what should this figure be, really?
7.
Yeah. What about postprandial? Do you know what postprandial means?
After food, is it?
So it can go up to, it's between 7 and 15.
7 and 15,
Yeah.
Okay.
Yeah. The following customers asked to buy a non-prescription medicine. Given there are no contraindications, it would be appropriate for you to make sell to which of them? A 17-year-old woman who wants to give up smoking asking to buy Nicorette chewing gum. That sounds alright, doesn't it? There's probably no license, probably above 16. I wouldn't really think it's 18. A man asking to buy Phenergan elixir. What is this? What do people use this for?
Promethazine. Phenergan for travel sickness?
You can use it for travel sickness, you're right. But a lot of people use this as a sedative.
Sedative.
Yeah,
Okay.
knocks them out. This, a man asking to buy Phenergan elixir for his 18-month-old son who's having trouble sleeping. So you need to know the license of the P of Phenergan.
Okay.
And this is a problem in the exam because where can you reference this question?
Yeah.
You have to know this off by heart.
By heart, yeah.
A woman to buying Spasmol capsules, Alvarin, so it's like Mebeverin, for her 10-year-old daughter who's suffering from stomach cramps. So again, you need to know the licensing of these two medicines. What's the answer for? Oh, it's in the BNF. So it's BNF for children. Oh, of course, yeah. Yeah. So the licensing of the P medicine is in the BNF for children. The answer is D. So D means only one is required. So this is the only one that's applicable. So if you look in the BNF, it would say, oh wow, so Nicorette can only be given to people above the age of 18. And I think promethazine is above the age of 2.
Okay, I'll write it down. Promethazine.
This is a good one. Hepatitis B vaccination is recommended for individuals at high risk of contracting the disease. In the UK, which of the following groups falls into this category? Individuals with RA, individuals with chronic liver disease, foster carers.
So if it's in the BNF, shall I just have a look?
Yeah, what's this called? What kind of health? What kind of medicine? It's called occupational health.
Oh, okay.
They're at risk during their occupation. You can do this by common sense, actually. Would someone...
Because you would know that, chronic liver disease would be at risk one day.
Would this be a risk?
Rheumatoid arthritis, no.
The only one that you're probably unsure of is this one.
Yeah.
But, no, you look up hepatitis B, you look at... There's a section about occupational health.
Okay.
And it's all here.
Oh, wow. Okay.
So rheumatoid arthritis...
So, yeah.
Go on. Okay. Rheumatoid arthritis, definitely not. But you've got to think of anyone who might come into contact with someone with hepatitis B, and right at the bottom is that. So foster carers. And you can think of it logically because, foster carers are going to have a high turnover of children. A lot of foster carers are probably related to kind of social services and even like kids coming out of jail as well. So, where have those kids been? Are they drug addicts? Blah, blah, blah. So adopting children from other countries, custodial institutions. So if you're in prison or you're a prison warden, daycare, residential accommodations with learning difficulties, so like autism and stuff. Morticians and embalmers because they're dealing with dead bodies. Lab staff. And it's sexually transmitted, so you've got to keep that in mind. So what was the answer? Answer is C, which probably...
2 and
3. So these two, yeah. Good. Which of the following statements is correct regarding patient counselling? A patient taking flu clox should be advised to take each dose immediately after food. Okay. A patient using fentanyl patches should be advised to avoid exposing application site to external heat, such as a hot bath. Okay. A patient using lidocaine 5% patches should be advised about signs and symptoms of opioid overdose. Okay. A patient taking 1 week course of oral prednisolone should be advised that the dose should be reduced gradually when stopping. A patient taking Orlistat and a multivitamin preparation should be advised to take the multivitamin immediately before breakfast. Merlin, so each one of those options, tell me your thoughts.
I'll tell you. A patient taking flu clox, best to take after food. Because when you look at them, most of them look alright, but I think what they're looking for is which is important that you should tell them. So I would go for B because fentanyl patches, if you apply it avoid exposing. It will increase absorption, and yeah, you get respiratory depression with
Yeah, but you're more worried with fentanyl. You're more worried about initial nausea, really, with fentanyl. You're right with respiratory depression, but that's really kind of like in overdose.
Okay, but yeah, so you would think about that and you go for that because I think that's most.
Yeah.
What is this?
Penicillins. How do you take penicillins? What do you tell the patient?
Penicillins, you take them after food?
Can you check it? Check it in the back of the BNF. I think it's an hour.
Okay, I'll check. 1 moment.
Hour before. I think it's an hour before.
It's an hour before food. 9:23 it says. Take this medicine when your stomach is empty. This means an hour before food or 2 hours after food.
Yeah.
So you can't take it after food.
Yeah.
So
So
that would be wrong.
Yeah. So you have to remember anything ending in cillin. So flucloxacillin and phenoxymethylpenicillin.
Yeah.
That's applicable. So an hour before food.
Okay. An hour before.
Yeah. For any cillins.
Okay.
Yeah, I'm kind of agreeing with this. What about this one?
After food, lidocaine patches should be because lidocaine, it's an anesthetic, isn't it?
It's not an opioid.
It's not an opioid.
What about this one?
A patient taking a 1-week course of oral prednisolone should be advised that the dose should be reduced gradually when stopping. I think, yeah. But is it not that they should consult the doctor if they're before stopping?
No. With oral,
I think, Mike, because if it's more than 3 weeks, then they need to reduce
Very
it.
good.
If it's for 1 week,
it doesn't matter.
then it doesn't matter.
Patient taking orlistat and a multivitamin should be advised to take the multivitamin immediately before breakfast.
Yeah, because immediately before.
What is orlistat? What does it do?
It inhibits absorption of vitamins.
No.
Of fat.
Fat. Yeah. What enzyme does it inhibit? Lipase. Okay.
Lipase.
So, lipase. Yeah. So it's a lipase inhibitor. Stops the absorption of fat.
So it would be all the fat-soluble vitamins.
Exactly.
Won't be
which are what?
A, D, and K.
A, D, E, K. Yeah.
E, K. Okay.
So you're right. So it's this. I don't really understand this actually. A patient taking orlistat capsules and a multivitamin preparation should be advised to take the multivitamin immediately before breakfast.
Because then the multivitamin, you will absorb the multivitamins and the food.
Yeah. But you're supposed to take orlistat 3 times a day.
Oh, okay.
So if you take it in the morning, you're supposed to really take it. You're supposed to take orlistat within 2 hours of eating your food. Yeah. So. Yeah, but
it doesn't make sense, does it?
Even if this is like a little bit ambiguous, you know that this one is the important one.
Yeah.
So you go for that one. Which of the following is a side effect of dabigatran, whatever? You just look in the BNF. Easy.
Oh.
That should take you 1 minute to do that.
Okay, let me just see if I can do it. I didn't mark my BNF because I'm waiting for the next one.
Yeah.
152. Side effects. which is nausea, dyspepsia, diarrhea, abdominal pain,
Yeah.
anemia, and hemorrhage.
So yeah. So hemorrhage.
Hemorrhage, yeah.
Yeah, so number 7. You received prescription 6-year-old boy continued phase of treatment for TB. You've taken rifampicin, isoniazid, and pyridoxine. The most likely reason for pyridoxine is correct vitamin B6 deficiency.
Yeah.
Yeah. Prevent drug-induced peripheral neuropathy. Prevent drug-induced megaloblastic. Improve efficiency of isoniazid. Improve patient's appetite. 8 is B. Yeah.
It's A, isn't it?
It's
B6.
B. No, it's not B6.
No?
No. It's prevention of neuropathy.
Isoniazid-induced.
Do you know why it's not B6?
No.
Because what is B6?
Thiamine, is it? No.
No, niacin.
Niacin.
You have to know all of the B's off by heart. I remember it as train PC, so TRNPC. T being B1, thiamine, R being B2, riboflavin. Oh no, you might be right actually. TRNPC. Oh, it is pyridoxine. You're right.
Okay.
Yeah, so T is thiamine, R is riboflavin, which is B2, B3 is niacin, B6 is pyridoxine, and B12 is cyanocobalamin.
Oh, okay.
Yeah. So you jumped at that, but that was the actual one. So you'd look that in the BNF though. Yeah,
Oh, okay.
pretty easy.
Fine.
I hate these questions. Do potential pharmacy prescription for the following: furosemide 40 mg BD, so 80 mg overall. Tells you that her first dose of furosemide has just been increased from 40 mg in the morning, and wonders what time of day she'd take the second dose.
She should take it in the evening because then she doesn't have to get up in the get up at night and then risk falling. How old is she? Doesn't say.
No. Yeah, you're right. Yeah. All suspected adverse drug reactions in children.
So for the 9, so it would be that A for the first statement is true, but then the second statement does not.
It's false.
Yeah, so it's
and it's
B.
not a correct explanation.
No.
So 9.
It's
9 is C actually. Why did you say B? B. No. Second statement is a correct explanation of the first.
No, so the first statement is correct, but then you said that
Wait, hold on.
Yeah, you're.
C. 9 is C. So the first statement is correct that you should advise Mr. D taking a furosemide in the morning and at lunchtime because of nighttime enuresis. Yeah, enuresis. It's wetting yourself.
Yeah.
The second statement is false. Furosemide can cause nightmares if taken in the evening.
Let's see.
C. I think that's correct.
Yeah.
And that's correct. I'd say it's A. That's B.
Does the black triangle not also say the newly?
It's mainly the new ones.
Okay.
Oh yeah, so that is incorrect. Sorry, yeah.
These are quite confusing.
This is ambiguous because they're monitored intensely. It's not just that they're new. Don't like that question. That was quite good. I like that. Visit pharmacycpa.com for the full video series. As always, for more information, please subscribe to our YouTube channel, join our free PCPA course, join our Facebook group, or subscribe to our blog.